So the fifth step is you need to conduct a mental state and physical examination. We're looking for things that may mimic dementia. Many of them start with D, depression, delirium and drugs. So depression, sometimes called pseudo-dementia. So people with depressed maybe show less initiative, maybe more withdrawn, have problems with concentration, memory is poorer, but in a different way, it's patchy. It's not just short-term memory. Delirium is an acute confusional state and is often confused with dementia. But it's more rapid onset. It's more it fluctuates. Classically, there's a reverse of sleep-wake cycle. 2/3 of people with delirium have an underlying dementia. And we see this in hospitalised patients who come in and people don't know they have dementia and they develop a post-operative confusional state, or they have an infection when you see them and they become very confused and delirious. And when the infection clears, traditionally we're told the delirium recovers and they're back to normal. Well, in fact, sometimes people don't go exactly, they go down, then they come up, but not quite to the level where they were before. So follow-up studies are showing delirium doesn't always completely recover, and particularly where there's an underlying dementia. So people can have both delirium and dementia. And drugs, particularly drugs which have anticholinergic properties, can interfere with cognition. We're used to the antidepressants, the old tricyclics that people don't use as much. Things like amitriptyline have a high anticholinergic load. The older antipsychotics have a high anticholinergic load. But drugs like digoxin, furosemide, also have anticholinergic properties. There are indices of drugs which you can add them up and you can have an anticholinergic load from drugs you didn't suspect were doing that. In a lovely study from France, they showed a nice correlation between anticholinergic load and poor cognitive performance. Then they did the next step. They withdrew the drugs that were anticholinergic and they found cognition improved. So think about the drugs you have your patients on. Drugs we use for the bladder. We use them for their anticholinergic properties, but we forget sometimes that it may affect the brain as well. We need to check their nutrition, their hygiene, their vision, and their hearing.